So we're talking about the fourth most common cause of cancer here in this country. More importantly, the second leading cause of death from cancer here in this country. So when I talk about colon cancer and more importantly, taking action against colon cancer, I think the title perfectly fits, especially when we talk about colon cancer awareness month, depending on when you're listening to this or watching today's episode. But I have a few hopeful facts and discussions on colon cancer that I think once we kind of get, I guess, our minds around it, will help you understand just why we think it's so important that it needs a whole month. And again, even though we're going to talk about it during this month, this is a topic that I will touch on every single year. I will refresh every single year because that is how important it is to not only to the communities I take care of, communities I serve, but everyone who are in earshot of hearing the words today. So let's give some numbers. And I love talking about the numbers because I think a lot of times when we talk about these diseases, a lot of times we kind of think like, okay, yeah, I've heard of that. I've seen people talk about it, but like, really, how big is it? So let's give some numbers. This year, 2023, 153,000 people will be diagnosed with colon cancer. I want you to think about that. 153,000 people will be diagnosed with colon cancer. Even worse, 52,000. This is rough estimates, but unfortunately, we've been kind of right every single year prior, so we're kind of good at this. 52,000 people will die from colon cancer in the year 2023. Again, when you're the second leading cause of death related to cancer, those numbers kind of roll up. And even more important, especially for my young superhero audience who doesn't think anything's wrong with them, who goes with the flow, who doesn't see their doctor regularly, since the year 2007, the rate of colon cancer has increased by about 2% in those under the age of 50. So this disease is no longer a disease of the old people, which we used to think about. When I was a medical student, a lot of the focus was, hey, at the age of 50 or 45, depending on who you are, we start screening. But more and more as the numbers come out, as the statistics come out, as society and the way we kind of process and do things changes, we're being very diligent to the point where now the age of 40 is when we start thinking, hey, you know what? You should be worried about colon cancer, or more importantly, let's just say thinking about colon cancer. We're not going to say worry. We're not here to scare anyone. We should at least be thinking about colon cancer. And for the community that I typically serve, the African American community, these are some numbers that I hope are eye-opening to you. It shouldn't be, especially if you listen or watch me. If you're African American, you have the second highest incidence and mortality rate due to colon cancer. You have a 20% higher incidence rate of colon cancer than other races. You have a 35% higher mortality rate, meaning that you are 35% more likely to die when you are diagnosed with colon cancer if you're African American. And lots of different reasons behind that. The biggest being that we don't get tested enough. And when we do get tested, we get tested and get found that we have colon cancer at a much later stage. And again, this isn't something that's just exclusive to colon cancer. I've talked about this on prostate cancer. This is just an issue we continue to have to deal with, especially in our community, as far as not being tested adequately. And when we do get tested, there's less options for us for treatment, either because we're refusing treatment or the options aren't available because it's being caught so late. So let's talk about let's just again understanding what colon cancer is, because again, this is a buzzword that you're going to hear all month. You're going to see a lot of societies, a lot of people wearing ribbons and everything, kind of focusing on colon cancer because again, it is the hot topic of the month. But let's talk about it. So colon cancer, again, is just as it says, cancer of the colon, cancer of the rectum, the large intestine, essentially your significant GI system, colon cancer. And colon cancer is one of those things where it's not fast in regards to like, all right, if I find the precancerous lesions today, it'll spread everywhere in less than 6 months. No, it's a little slower growing pace of cancer, which is why it's so disheartening when I talk about the numbers I talk about, because I understand that, man, if we could have just had the evaluation that we should have had at the time we should have had it, maybe we catch this earlier. So I think that's important. So that's why when we talk about colon cancer and understanding that it is a cancer, but it's one of those ones where if we do a good enough job with the prevention aspect of it, and we'll talk about that. If we do a good enough job with the preventative aspects associated with colon cancer, guess what? We can get it to the point where we don't catch it late. And that's our biggest issue. We are catching colon cancer way too late, to the point where it should not be the second leading cause of death in our country. It just shouldn't. When we think about all of the things that have to occur, especially from a time duration standpoint, for colon cancer to get as bad as it is. And there's two types of colon cancers. Predominantly, adenocarcinoma is about 95% of colon cancers, with the squamous cancer resulting to about 5%. But again, 95%, that's typically the one we focus on. The 5% is usually more rarer, usually more deadlier because it is more rarer, but usually adenocarcinomas are the one we're always concerned about in regards to the types of cancers that are out there. Let's talk about some causes, some risk factors. And this is something that when I always approach the discussion of a disease, and I've talked about causes, risk factors, I love to split it up into things you can change versus things you can't really do nothing about. So let's focus on the things you can't do nothing about. This is a big one. You've heard it before. Age. We can't do nothing about our age, but we know that the older we get, the higher risk of developing colon cancer is. Now, again, remember my words earlier. That doesn't mean that you should think that, all right, I have to wait till I am quote unquote old to be worried about colon cancer. Because again, since 2007, the rate of colon cancer has just continued to increase in those under the age of 50. And we'll talk a little bit at the end of why I think that is. I got a couple hypotheses that I think you should stick to the end for. Now, genetics is a big one. So family history follows right along the lines of things we can't do nothing about. You can't do nothing about your family history, but it's so important to understand your family history, because if you know that you had relatives who got diagnosed with colon cancer at certain ages, guess what? That clues the healthcare professionals to say, hey, if your relative, your mom, your dad, your uncle was diagnosed with this type of cancer at the age of 42, guess what? We're going to look at it in you in a much earlier age. Like, we're not going to wait till 42 to start checking for colon cancer if you already had family members who were diagnosed at that age. Because again, we want to prevent it. We don't want to treat it. We want to prevent it. Despite what the popular belief may have you believe, healthcare wise, we actually would like to prevent these things instead of worry about treating them and all of the options that come with treating. We don't want to have to treat if we can prevent. So we have the age, we have the genetics. Now, race is a big one. I highlighted it. We know that because if you're African American or Hispanic, you are a higher risk of not only getting colon cancer, but you're a higher risk of dying from colon cancer. So your race plays a significant factor. I remember when I was in medical school, the age of screening for colon cancer in the general public was 50 years old. Like, that was the age. Except if you were African American. Because if you were African American, they say, you know what? By the age of 45, you should start looking. You should start thinking about it. And the reason why they did that is because they saw, again, this population of people are not only developing it much earlier, but they're developing it. And by the time we wait till they're 50, it's so advanced that they're dying from it. So age is a significant risk factor associated with the development of cancer. Race is a significant risk factor in the development of colon cancer. Genetics is a significant risk factor in development of colon cancer. Now let's talk about some things that you can't really. Gender is in there as well too, right? But let's talk about some things that you really can't, that you can do something about. The big ones that I always talk about: dietary habits. We're going to talk later. We're going to talk about some dietary habits that may be adding to it. Not to say, and I want to make sure y'all get this, I'm not saying when I talk about it towards the end, the foods that are good for you or the foods that are bad for you are ones that are definitely causing cancer. No, I'm not saying that. I'm just saying that there are risk factors associated with it. So when you have to balance out, like, hey, all right, how do I reduce my risk for developing colon cancers and just cancers in general? We think about, all right, what are some dietary components that I may be able to add or subtract in my diet that helps me out? Smoking, again, just if you're smoking and you're listening to this channel here, understand that, like, my goal is always to bankrupt all of the tobacco companies, because nothing good come out of tobacco companies. It just is. Like, nothing good's come out of that. Alcohol use is the big one. Alcohol use is a big one as well, as far as risk factors associated with an increased risk of developing colon cancer. So excessive alcohol use and sedentary lifestyle. And I think that kind of goes along the lines with the dietary component. I think that goes along the lines with just everything else. If you have a sedentary lifestyle, it has been shown that there's an increased risk factor. Again, not to say that you can't be an athlete or bodybuilder, stay in a gym and you can't develop colon cancer. I'm not saying that. I'm just saying that if you have a sedentary lifestyle, the risk factors are there. So let's talk about the symptoms. Let's talk about some symptoms that we know when you come to my office, especially when I used to do outpatient medicine. When you came to my office, these are the things I would ask. Hey, when's the last time you checked your poop? And it always gets a laugh out of all of my patients every time. But you would be surprised, again, if you're watching this or listening to this on the podcast, you'd be surprised when I ask someone, hey, when's the last time you checked your poop? How many people will go have a bowel movement and then flush the toilet? They never actually look at the bowel movement. And I know, yeah, it sounds disgusting and cringy, but if you never look to see what your bowel movement looks like when it's normal, how are you going to be able to tell when it's abnormal? Because from a physician healthcare perspective, one of the questions we're going to ask is, have you had any change in the character of your stool? Because we know that could be a very early sign for colon cancer. So again, if you're listening to this, you're watching this, and you can't remember the last time you checked your poop, go ahead, check your poop. And again, I'm not telling you to check your poop every single time. Every now and then you just hit a glance back there and say, okay, that's what that looks like. And then keep it moving. Just so you have a mental picture of what it looks like when it is normal. Because when it is abnormal, guess who's going to be the first person to recognize it, or should be the first person to recognize it? And that is you. We know that colon cancer can be associated with weight loss. We know colon cancer can be associated with abdominal pain and discomfort. We know that colon cancer can be associated with just change in bowel habits. So maybe you're a type that you go to the bathroom and have a bowel movement every 2-3 days. That's your normal. Now, all of a sudden, you're having lots of frequent diarrhea. So all of a sudden, like, wow, I'm going to the bathroom a lot more, than more often. My stool, again, that character isn't as formed, and I'm losing some weight, and I have an appetite changes. So there's a lots of different constellation of signs and symptoms that you could be, the first line to be aware of. But again, I think a lot of it starts with understanding, all right, how do I poop? Let me check my poop out. I need to know. In fact, maybe I should change the title. If you're if you're watching this or listening to this, hit me in the comments if I should change the title to make sure you check your poop, right? Because I think that's how extremely important it is in this battle against colon cancer. Like that's really, first and foremost. Now, when we talk about these signs and symptoms, you've made it to your doctor, and now it's time for your doctor to check to see, hey, you know what? Now let's get to checking. We've got several different options for us. And there's some non-invasive options, and there's some invasive options. And I'll kind of give the pros and cons of both. So we have our regular stool test. This could be done in the comfort of your home. This could be done in your doctor's office, right? This is where, again, you just go, you check, they give you like a card, you smear some of your poop on there, you package it up, and you send it away, especially if you're doing it at home. And sometimes this could be a very early warning signal for changes to come. Because when we're checking for stool, things we're checking for is bleeding. Because obviously we're not going to know if there's cancerous cells in there, but we'll know if you're bleeding. Because we know early signs and warning signs is for colon cancer is stool in the blood. And that's why I say when I talk about making sure you check your poop, because imagine if tomorrow, after you listen to this video, or listen to the podcast, watch the video, and you check your poop, and then all of a sudden you look back there and there's blood in the toilet, something you never like. Hold on, why is the stool? Why is my toilet bloody? That you got to be worried. That should be some concern. That's something you got to go like, oh, let me go get this checked out. I don't want to miss this, right? So a lot of times when we're doing the stool card, we're checking for blood because that could be an early warning signal. Now, full caveat, you can do those stool cards and have a negative stool card, meaning that, hey, I don't see traces of blood in there, but that does not mean you don't have colon cancer. So it's not, the best test from a specificity standpoint. It's pretty sensitive. You got some blood in there, it's going to find it. But specific wise, it's like, all right, I got blood, but that doesn't mean this blood's from cancer. It could be due to hemorrhoids, right? Could be due to, I was just straining. I'm pretty constipated. I strained a lot. Boom. I got some blood in my stool and it pops positive. And then all of a sudden, is this really colon cancer or not? So those are non-invasive, right? We have another one, which is fairly newer in the past, decade or so, is now you have imaging studies, right? So you can actually go and get a CAT scan of your colon to see if there's any growing polyps or masses there, which is good because it's non-invasive. But one of the things that I think it's a drawback is, I think it's a couple. One, for you to do that stool study test, the diagnostic test, you got to drink the prep. And for those who have gotten a colonoscopy or those who are afraid of the colonoscopy, one of their biggest issues is that the prep that it takes to clean out your colon, they hate it. And because they hate it, they don't want to go through it. But guess what? If you gotta go through the prep just to do the diagnostic study, because guess what? If you don't do it, let's say you do it, but you kind of half-ass it, right? You don't really go in, you don't really drink the full bottle, and your stool isn't clean. Guess what's gonna happen? We're gonna say, hey, you know what? The stool sample, the colon wasn't as clean as we want it to be. Recommend doing it again. Then you got to do it twice. And you always would rather do something like that one time. So you got to go through the full process of drinking all of the solution anyways. And then if they happen to find something that's abnormal, guess what? You got to go through that process of drinking all the solution again, and then scheduling the colonoscopy, which is the invasive procedure. This is the endoscopic procedure where they stick a tube with a camera through your butt just to see the lining and the anatomy of the colon. And you can do a flex sigmoidoscopy, but like the gold standard is definitely colonoscopy. So that's one of those things where, again, and yes, you are sedated. You're sedated, but you're not out because you have to be awake because a lot of times your doctors are asking you questions, having you reposition and move over. So you're fully with it. But usually you have some type of amnesia because of the medication that they give you from anesthesia standpoint. So it gives you a little what we call retrograde amnesia. So you don't kind of remember what happened during it, even though you were able to kind of follow directions. So that those are our diagnostic tools. And I think it's good to understand and kind of give your patients those options, making sure they understand the pros and the cons of either or. That way they can make informed decisions upon themselves and not be, stuck on like, oh, I don't have to go through colonoscopy. Especially because at certain ages, we stop, especially if you've had good colonoscopies in the past, we don't do the colonoscopies because, it comes with some risk as well. It's a long tube, right? There's some risk factors, some dangers that can come with that long tube. So it's not something that's completely benign. So you have these pros and cons that you have to weigh out with your patient when you're thinking about, hey, you know what? I think I want to go through this modality versus that modality. And I talked about obviously getting your regular checkups from a prevention standpoint. I'm sorry. Yeah. So from a prevention standpoint, this is our next section. Obviously, regular checkups, getting your family history, getting a good family history, making sure they understand and everyone understands, hey, so and so had colon cancer in this age. You should start checking it. You should start checking it. You should start checking at an earlier age. There's some dietary things we always think about, and these are some of the good things that I want to kind of mention. So these are the good foods. Again, when I say good foods, I'm not saying that these foods are the only thing you should be eating. I'm just saying that we have seen that certain risk factors associated with inflammatory properties and oxidant related damage to the colon has a possible risk factor in developing cancer. So guess what foods we recommend? Foods that don't do that. Foods with good anti-inflammatory properties, with good antioxidant properties, with good binding properties, so stool waste doesn't sit in your colon for a long period of time. Fruits and vegetables, grains, nuts, right, and seeds, fish, right. These are like in our good side of foods that you should be eating and try to eat of in abundance, especially if your risk factors are there of concern. Now, the foods that are of concern, foods that you should again be, I don't want to say cold turkey, but foods you definitely should be wary of are red meats, processed meats, because of what we talked about. That there's some inflammatory processes associated with those types of foods. So guess what? We don't want inflammation, right? We talk about the aspect of the anti-inflammatory properties. So we don't want inflammation, which foods like red meats and processed meats may result in. Sugary foods as well, sugary drinks, sodas of alike play a factor. And then alcohol, of course, right, plays another significant factor, right? So these are the foods that are in the bad quality, that are in the with moderation category. Not to say that you can't have your red meats, not to say that you can't have your sodas, not to say that you can't have your alcohol, but we do think we should moderate how much we're getting, especially if our risk factors are there. Because we've had, unfortunately, plenty of people, again, when you're the second leading cause of cancer-related death in this country, you're going to know some people who've died from colon cancer. I think the biggest one, and we've talked about this here on the show, Chadwick Boseman died from colon cancer. He wasn't even the age of 40. We had our Supreme Court Justice, Ruth Ginsburg, died from colon cancer. Right? So again, young, old, right? We've had several people die from colon cancer derived from the colon. So it's definitely something that we can't take lightly. And even though as this month goes by and it flies by and you don't have to worry about it in the month of April and they're to talk about another disease, understand that this topic here, this disease here is not going away. And the likelihood that you in your lifetime are either going to be directly or indirectly affected from it is so high that we should, and more importantly, especially if you're listening to me, we will take action about it today. So again, I'm yours truly, Dr. Barry. Again, remember, empower yourself for better health. For those who want to follow the Patreon, link is in the bio. Make sure you join the Patreon. So we have some great private discussions in there. And you guys be blessed. And I'm going to see you guys next week.